Meniscus tears are one of the most common injuries in orthopedic surgery and orthopedic sports medicine. Active duty military service members suffer them very frequently. But the potentially bigger problem comes years later when the veteran develops knee arthritis. I'll talk about how and why that happens in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Now, I've discussed meniscus tears, what they are, treatments in a number of different videos on my main YouTube channel, but just for sort of a brief overview, the meniscus is the C-shaped cartilage on either side of the knee. You see it there and there. And they're very frequently torn with specific injuries, especially when you're younger. A twisting injury is typically what it is, but there's any number of acute ways it can be done. Now, as you get older, you can get degenerative meniscus tears that just come on with age. But what I see so often in members of the military is they had a specific knee injury that led to a meniscus tear. Now, a long time ago, especially before there was MRI, and you go to sick call, it's not an orthopedic surgeon there. They just say knee sprain, and then because of pressure put on members of the military to just go back to work and not take time off. And there's just a lot of pressure in the military. Maybe they never get a real diagnosis, but a lot of times that acute event in the military led to some of the problems they have later. Now, they occur at higher rates in the military than in the general population. There was one study that estimated that the incidence rate of meniscus tears in the U.S. military is almost 10 times higher than that of the civilian population. In another study looking at members of the military who needed surgery for a meniscus tear, over half required surgery for that injury. Now, again, meniscus tears are the most common knee injury suffered by active people and probably the most common knee injury suffered by members of the military. And it very often leads to arthritis down the road, what we call post-traumatic osteoarthritis. Meniscus tears are one of the 5 major risk factors for the development of post-traumatic osteoarthritis. The authors of the study that showed meniscus tears, or they said meniscus tears have been highly linked to the development of post-traumatic osteoarthritis, and they're a major independent risk factor for progressive osteoarthritis. And that's why I see it so often in veterans that reach out to me with chronic knee pain, chronic osteoarthritis. They had a meniscus tear earlier during their military service. If you have ideas for topics for future videos for this channel, injuries, risk factors, Nexus letters, DBQs, whatever it is, leave those in the comments below. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or condition, click the link in the description below and you can learn more about working with me and working with my team. We do everything we can to make the process simple, to make it quick, and I try to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you.